My name is Jody Stewart. I'm making this presentation for a class at Pittsburgh State University. I'd like to present my PowerPoint on the misuse of opioids, a policy for change. Our Missouri Governor, Eric Greitens, says that opioids are a modern plague. 2 Missourians are dying every day and hundreds of other lives are being destroyed. Each of us, in our own ways, can take action to do something positive. Together, we can save lives. The problem overview. The CDC shows a significant increase in opioid-related deaths in Missouri of 21%. The U.S. Department of Health and Human Services in 2016 stated 116 people died every day from opioid-related drug overdoses in the United States. As of 2016, the number of people who have died from overdosing on opioids is estimated to be at 42,249. In 2016, 908 opioid or heroin-related deaths were in Missouri. 1 of every 66 deaths in 2016 in the state of Missouri related to the use of opioids or abuse of opioids. This is compared to 2015, when 1 in every 89 deaths was related to opioids. Opioid overdose deaths make up 65% of all drug overdose deaths in the state of Missouri. Dash with CNN says the opioid epidemic claimed nearly 64,000 lives in drug overdoses in 2016 and has killed more than 500,000 people since 2000, according to the U.S. Centers for Disease Control and Prevention. As you can tell, the numbers vary on the amount of deaths experienced due to opioid overdoses. However, the fact remains that the number of deaths is large and something needs to be done. This is a real problem, and it is a problem we can do something about. Problem severity. More than 2 people died every day in Missouri in 2016 due to opioids. In fact, according to the Missouri Department of Health and Senior Services, 2.5 people died from an overdose every day last year in 2016. Every day. This compares to 1.8 overdose-related deaths the year before. Opioid-related deaths are on the rise in Missouri. The Missouri Foundation for Health states that between 1999 and 2015, opioid-related deaths in the United States quadrupled. Missouri alone experienced a 273% increase in the number of overdose deaths between 1999 and 2015. 2.6 million people suffer from opioid use disorder in the United States today. According to the New York Times, this number may be closer to 5 million because experts say the data is based on a government survey where people are asked about their drug use. The legislation overview. The Opioid Prescriber Accountability Initiative. Starting this past March, the Department of Social Services, the Department of Mental Health, and the Department of Health and Senior Services will begin enforcing national standards for prescribing opioids to chronic pain patients. President Trump plans to declare the opioid crisis a national emergency. President Trump's Opioid Commission had previously recommended that he declare the opioid crisis a national emergency. One of the bills submitted before the House Energy and Commerce Committee, called the Preventing Overdoses While in Emergency Room Act, or POWER Act, is a bipartisan measure that seeks to provide patients who have overdosed better access to treatment when they get discharged from emergency rooms. State prescription drug monitoring programs are recommended. Katz states that officials want to use state prescription monitoring programs that will reduce the supply of prescription opioids that end up being used recreationally while maintaining adequate access for current chronic pain patients. We need to change the way our medical system manages pain. More broadly, these experts advise we change the way our current medical system manages this pain in a more holistic approach to pain treatment. House lawmakers to introduce bills. Darsh with CNN reports that House lawmakers plan to introduce more than 24 bills aimed at ending the opioid epidemic. ranging from better access to treatment programs to exploring opioid alternatives to pain. House Bill 2105 is currently in the Senate. State Representative Bill White, on his 2018 legislative session update, tells us the Missouri House voted to take more steps toward fighting opioid addiction with an increased focus on prevention and treatment availability. One of the bill's main provisions would be to limit the amount of an opioid that could be prescribed, to help prevent addiction and to remove unused opioids from the market. This bill would also create a voluntary prescription registry. Medical schools, with training doctors, they are starting to teach them about issues related to opioid dependence. Dr. Rajput states that medical schools and pharmacies have already made changes in response to the opioid epidemic. For example, Ross University School of Medicine is actively training future doctors with this issue in mind, offering courses and clinical rotations in drug addiction treatment and pain management. Problems: the availability of addiction treatment. While speaking at an opioid summit, Dr. Price mentioned 90% of Americans struggling with addiction are not currently getting treatment. Katz states expanding access to and funding development of medication-assisted treatment, eliminating Medicaid barriers to inpatient addiction treatment, and enforcing laws that prevent health insurance companies from limiting mental health coverage will assist those who are dealing with an opioid addiction with access to addiction treatment centers. The CDC advocates to increase availability of and access to treatment services, including mental health services and medication-assisted treatment for opioid use disorder. Naloxone availability, the distribution to first responders, family and friends, and other community members in affected areas is recommended by the CDC. Dr. Price also mentions the importance of promoting the use of overdose-reducing drugs. Prevention. Education for providers with prescribing opioid medication. Health departments can, according to the CDC, support the use of the CDC guideline for prescribing opioids for chronic pain, which is encouraging using prescription drug monitoring programs known as PDMPs to inform clinical practice. Unintended consequences. Demand for medications such as naloxone may exceed supply. Dr. Leona Nguyen, the Baltimore City Health Commissioner, says, example, residents in Baltimore have saved more than 1,600 lives due to a policy that helped provide naloxone to every resident in the city. But the city is having to ration a limited supply of the life-saving drug. How do we decide who gets naloxone? Who should have it available? Obviously, emergency departments and emergency response teams should have it, but as previously suggested, should this medication be available to friends and family members of an addict? Is there a potential to abuse it? Cannabis for chronic pain. Dr. Stoll, via Sandu with the USA Today, states that he would not immediately discount someone if they used cannabis for pain. Weighing cannabis against opioids for chronic pain makes it look like choosing between two evils. The use of the pain scale in healthcare. Dr. Rajput feels the pain scale shares the blame for the opioid crisis in America. He states to help curb this crisis, we need to move away from the pain scale, including the visual analog scale, and instead ask patients about their abilities to function at work, home, or in other daily activities. Recommendations. Alternative therapies to opioid medications. Sandu, while interviewing Dr. Stoll for USA Today, quotes him as saying, "Not all solutions are medication-related. Other alternatives such as exercise, laser therapy, acupuncture, massage, spinal manipulation for back pain, and behavioral therapy to learn relaxation, meditation, and mindfulness techniques are all choices in the treatment of chronic pain." The reduction in number of opioid prescriptions written will help reduce the amount of opioids available. And access to treatment centers for opioid addiction will help current addicts get help and assist to end this epidemic.